Everyone, my name is Kimberly Orozco. I am in the Biomedical Academy at Jesse Bethel High School. I am a part of the Youth in Action for Health project that is in collaboration with Touro University. Other peer health promoters will be giving this presentation, including Richard, Jonathan, Ashley, Denise, Justice, and myself. There is a significant health and educational equity gap in the United States affecting low-income and ethnically diverse youth. These decreased opportunities associated with poor academic success have resulted in low numbers of ethnically diverse students being engaged in health science professional careers. It is crucial to have a diverse public health workforce to respond adequately to our national health equity crisis. Current pipeline programs do not focus on health equity or on engaging youth as leaders and active participants in efforts aimed to increase health equity. Development of a YPAR leadership group provides important role modeling and a youth voice in all project aspects. Now let's hear from Richard.
There are 4 specific project goals: to promote youth development and leadership using a YPAR approach, to develop health promotion and health advocacy skills, to promote knowledge and interest in public health and related careers among ethnically diverse students, to integrate a public health equity focus in a high school biomedical academy program. Jesse Bethel High School is classified as a high poverty school with 55% of students socioeconomically disadvantaged. Jesse Bethel has a diverse range of students, including 30% African Americans, 27% Filipino, 25% Latino, 9% white, and 4% Asian. Results of this disadvantage are that math and English scores are lower than the state average, and dropout rates are higher in Jesse Bethel High School. Moving on to Jonathan.
So what is YPAR? YPAR is Youth Participatory Action Research. YPAR has youth and adults working together to improve the community through research techniques to fix difficulties and problems to improve the living of the community. So what does YPAR increase? YPAR increases the communication, critical thinking, and research skills within students' collaboration. It also increases the agency and leadership, precipitations of youth as change agents, social justice awareness, academic and career goals, social and cognitive development, relations with adults, and broader community. Over to you, Ashley.
As a peer health promoter, we met 3 times a month, engaged in cheerful activities that welcomed relaxation and bonding. We also participated in YPAR training and activities, assisted with developing student surveys and using the results in the classroom, assisted with developing and implementing our health promotion activities in classroom sessions too. On to Denise.
In our classroom sessions, we've had 12 per year. We've discussed Public Health 101, social determinants of health, health equity, and community change strategies. Our public health resources include APHA and CDC. We had student projects focused on youth-related public health issues, and we prioritized adolescents' health topics as mental health, violence, ATOD, and etc. As students, we've identified health promotion and advocacy projects. Back to Kim.
In our Youth in Action Symposium, youth panels from throughout the county were invited to speak to students. Students showcased their public health posters to all of the students in the Biomedical Academy, teachers, and even the principal. All of the posters consisted of different topics, their background of issue, data, statistics, and solutions, along with the recommendations using the sociological model. Let's move on to the questions. As a peer health promoter, I feel like I definitely gained a ton of new knowledge I was able to share with others. I gained public speaking skills that made me feel more confident, and I gained a ton of inspiration. I hope to continue helping those around me. This year, I was able to learn more about public health and how our community and environment has a huge influence on who we are and how we grow to be. What I liked most about this project was being able to collaborate with others and voice my opinions freely. I was also able to spread awareness amongst my peers on certain public health topics like substance abuse and mental health, which is something that was really important to me. I contributed to the project by attending our public health meetings consistently, and I was able to communicate with the rest of the group to come up with ideas on how to have other students feel engaged. Now let's hear from Denise.
So in Youth in Action, I learned quite a lot. I was able to learn how to take a topic and apply it to certain areas where they might be influencing, like with the upstream situation and equality versus equity, all important ways to help a community. The skills that I gained helped me self-improve from leadership skills to public speaking. I was able to voice out my ideas and collaborate with my peers in the group and in class. During Youth in Action in school and after school, I enjoyed learning and choosing the topics/ideas that we were going to discuss during classroom sessions. I was able to explore and indulge into the topics my peers and I were interested about. I helped contribute student feedback, how it felt learning those things in class, and what we can do to improve participation. I contributed efforts in creating a safe space where people can learn from each other and even help. Now on to Ashley.
I loved how collaborative the work was. It was always interesting to view things from someone else's perspective and be able to comfortably share my own thoughts and opinions. This year, I learned a lot about socioeconomics and how it affects the opportunities and availabilities of others. As a peer health promoter, I've been able to consciously and actively listen to others, learn more about the direct benefits and usage of public health, and develop a better understanding of what it truly means to be empathetic. I've also been able to see and feel the efficient teamwork. On to Richard.
As a peer health promoter, I gained leadership skills and more confidence in myself. I learned that younger voices are very essential to society. I learned more specific health-related topics, such as importance of mental health and drugs and tobacco abuse. The thing I enjoyed most about the Youth in Action project was the bright and interactive environment it had compared to school, allowing for open communication and fun activities. Being a peer health promoter, I believe that I contributed my voice and perspective to the program. Moving on to Jonathan.
What I learned, no, what I gained as a peer health promoter was public speaking skills and a deeper bond with my colleagues. I learned about the mental health of the community and drug usage. What I liked about the club was that it had an easy flow cooperation and it allowed an easy answer to problems we had. It allowed us to solve the problems and get to the next situation. And what I contributed was my voice and my collaboration. On to you, Justice.
The skills that I gained in the peer health promoter group was I learned how to have better public speaking skills because since it was a safe space in our group, they made me feel more comfortable and confident. And so when I had to present in front of the class, I felt those same feelings. Because on the very first day our group met, we had a practice of learning attentive listening because attentive listening is essential to being a good leader. I always loved on Fridays that we were able to indulge in real conversations and really stimulating ones. What I contributed was I got to contribute to our project. In my opinion, I felt like we could actually take action with how we felt. And now to the future of our group. Looking ahead, in next semester, we hope to continue doing career panels and also try and integrate career readiness skills. So since we're seniors, we can take a career in public health. And we also want to continue to do our health promotion advocacy projects. For 2021 and beyond, we want to develop a sustainable model for integrating public health with our Biomed Academy, and that includes our peer health promoter groups as key project partners in the classroom. For more information about our project, you can contact Dr. Annette Alberg at annette.alberg@tu.edu. Thank you for listening to our presentation.